Hello, my name is Samantha Keller,
And I'm Ben Keller.
and this is Preschool Assessment ages 3 through 5 years in partial fulfillment of our class Nursing 551 Health Promotions with Dr. Susan Petrin at Colorado State University in Pueblo.
Today we're going to cover a well child check for ages 3 through 5, which are preschoolers, screening including normal vital signs, anticipatory guidance, uh, and safety considerations, as well as developmental theories such as Erickson and Piaget and other milestones that they'll attain, and common acute care and chronic comorbidities that we need to be worried about as clinicians.
So, normal vital signs for children in this age range, the heart rate is 80 to 120, respirations are 20 to 28, systolic blood pressure is 89 to 112, diastolic is 46 to 72, and a normal MAP would be 58 to 69.
There's a trick that we do in the ER, just so we don't have to remember all of those different um, guidelines, and it's mostly for wanting to know for hypotension, and that's to take 70 plus 2 times their age. So if we're got a 3-year-old here, twice their age is 6, so then we would be concerned if their systolic blood pressure was 76 or less. Quick little trick. So one of the things we're looking at screening for growth and development, we want to compare that to previous results and age-appropriate guidelines to screen for any concerns. We want to check their height and their weight against growth charts just to make sure that they're growing as well as they should be and not being undernourished or being overnourished, as that can also be an issue. We'll talk about that a little bit later. Their hematocrit and hemoglobin should be checked once between ages of 15 months and 5 years. A normal H&H should be 35 to 45 and 11 at 0.5 to 14.5. And the reasons it could be abnormal might indicate a form of anemia or maybe a congenital clotting disorder. And this is a good time to screen for those so that maybe they got hemophilia or something like that and they need to know about that.
We also want to screen for lead, do an annual lead screening, and then check lead levels if it is indicated.
You know, my sister thinks I ate too many lead chips as a kid, and that's why I am the way I am.
She's probably right. So we also want to check urine just to see how their kidney function is doing. We want to look at any dental issues and provide education on dental caries and how to care for their teeth. We want to be checking for vision by using like a Snellen pictorial chart. We also want to be checking for hearing, so utilizing a whisper test, an audiometry if it's indicated. Most common causes of hearing issues at this age are earwax impaction and otitis media.
You know, I had lots of cases of otitis media when I was a kid. I wear hearing aids now, but I ended up getting tubes twice because one time they fell out. So, looking at some developmental theories, we have Erickson talking about initiative and guilt, and I'm pretty sure my mom was very much into Erickson as an educator because I always felt like she was on a guilt trip. Oh. Anyway, that the positive resolution in this stage is developing a sense of purpose and direction. Actually, my parents should be commended. I think I have a lot of purpose and direction. They, a good parent would give praise, set your children up for successes, and allow them to make small decisions, exercise some autonomy. And it's really important at this age to keep your words. If you're going to be giving them an IV, you tell them that it's going to hurt, or it's going to pinch a little bit. Or if you're going to be doing this, don't tell them it's not going to hurt. And if it hurts, you're going to lose their favor and their trust, and that's hard to get back.
Absolutely. We also look at Piaget at this time. So in Piaget, kids at this age are in the pre-operational. And so they are very literal thinkers. The words that they use represent the people, the objects, the actions, although they are starting to kind of learn how to generalize, but they're doing it inappropriately. For example, when it's raining, they think that they will say that the clouds are crying.
It sounds like a plot from Men in Black.
A little bit. Also, magical thinking. They believe that their thoughts cause other occurrences to happen.
So it'd be like if you got angry at your dog and a dog got hit by a car, they thought it was going to happen.
They thought maybe they would think that they caused it
and feel some guilt.
And feel guilt about that. Exactly. So some developmental milestones in growth and development. Children at age 3 should be able to copy a circle. And by age 5, they should be able to draw a person with 6 parts.
And then looking at vocabulary and cognition, the average 3 to 5-year-old has a vocabulary of around 1,000 words. Well-formed sentences. They're highly imaginative thinkers, and they fear disruption of their body integrity. And that can be a real challenge when you're taking blood or other samples. I've had them be all ready to go just to do like a simple strep swab, and then they're like, and it's okay. And I honestly can learn some better skills on how to navigate that.
So some of the things that we're looking for, of course, we're doing a complete head to toe with our physical examination. Some things of note is that with boys starting at age 4, you want to check for color vision. And
Checks out.
Yep. And also you want to look up their nose and look, just make sure there aren't any foreign objects. My sister, when she was 3, she would stick things up her nose all the time.
That's right.
Yeah.
Everything like peas,
Legos, that kind of thing. So don't forget to check. And of course, check their teeth and their mouth.
We're going to be checking their neck, and we want to note any absence of torticollis, cardiovascular issues. We want to assess for murmurs, clicks, rubs, regularity. They found a little murmur when I was a kid. Turned out to be a big murmur when I got older. Abdominal area, you want to give children control by having them place their hands on top of yours, and be sure to ask them if it's okay for them to listen or look at their tummy as it's a space, and that's a way of building trust.
We also want to be looking at their musculoskeletal, just assessing for gait. Do they have any abnormal gait? Do they have any bow-legged or knock-kneed? Anything that's going on with their genitalia, like labial adhesions and undescended testes, you want to be assessing for that at this age. And also, very importantly, you want to be looking at their how they're interacting with their caregiver, and kind of assessing their psychosocial interactions.
Indeed. One of the things that you want to look at is any kind of spiral fractures, because spiral fractures don't typically happen in kids. That could be typically a sign of abuse. Looking at psychosocial concerns, these are things that you want to be worrisome for. If they're timid, withdrawn, or fearful, maybe they're having trouble relating to or communicating with people, eating, sleeping, or toilet training difficulties, if they're moody, irritable, overly sensitive, maybe they're too passive or too aggressive, or maybe they're too passive aggressive. I don't know if they can do that at this stage. Maybe if they're impulsive, or they can't complete tasks, or they have speech, language, or motor difficulties. And these are things to be screening for. You can check in with a parent for getting a good history on that.
Mm-hmm. So as far as anticipatory guidance, we want to be looking at sleep. They should be getting 10 to 12 hours per night. One of the things that can help with this is consistent bedtimes.
Mm-hmm.
That's very, very important for kids at this age. They really need schedules that they can rely on. And those bedtime rituals really can help them transition. So read a book, get a drink of water, go to the bathroom, that kind of thing. Speaking of bathrooms, bedwetting is 97% of the time it is caused by a non-pathogenic cause. So our book, Collier, on page 346, gives some really great interventions to help with bedwetting strategies. So some of the things that we're looking at is, are they drinking too much before bed, and maybe cut off how much they're drinking a little bit earlier in the evening. Maybe the kids aren't able to wake up. And so it might be on the caregiver to wake them up after they've been asleep for a few hours, just to take them to the bathroom. They may be having an inability to delay urination, so they're not getting there fast enough, or they may have a small bladder capacity. So we want to help kids but not shame them, and help them get through that.
Well said. Safety is important at this age. Kids are more independent. Drowning is the most prevalent accident we see. So if you're around water, use water wings or life jackets when kids are around water, and make sure that there's an adult who is the designated lifeguard or water watcher to help for safety tip. Be aware of the child's location when starting up or moving a car. I've seen really concerning issues happen with that, just tragic circumstances. Stranger danger, don't, is good education there. Childproof locks are necessary, and they should be wearing a helmet. I see a lot of kids in the ER that aren't wearing their helmets, and they're getting in, rollerblading or skating or bike accidents.
Other things to look at is dental care. So teaching kids how to brush their teeth, utilizing a little bit of toothpaste, not a whole lot. They're going to be needing their first dental visit during this time, and fluoride is good for the development of their strong teeth. Also, we want to think about their nutrition. So we're thinking of a balanced diet, right? And kids at this age, they don't necessarily eat a whole lot at one time. So think of that balanced diet in a weekly perspective. They may be eating like a tablespoon or two of food. So offer a tablespoon of 3 different types of foods 3 times a day. And don't use food as a motivator. Don't force them to eat. They'll eat when they're hungry, for the most part.
Great, good advice. When it comes to parenting and discipline, provide clear limits, explain consequences. Ken Blanchard did this in the 1 Minute Manager, but that's catching a child being good and providing lots of positive verbal reinforcement. Make a child responsible for their own things, and timeouts of 1 minute per year of age are appropriate at this age.
So preschoolers are starting preschooler, but a lot of them are going to school or they're getting ready for school, and it can be a scary thing for them. So let the child know what that daily schedule is going to be like at school. Talk with them about their feelings, and help them kind of process those feelings about school. Maybe visit the school, meet the teacher to alleviate any anxiety. Meet a classmate if that's a possibility, and talk about all of the positives of going to school with them.
Excellent advice. Common acute care and chronic comorbidities. We see a lot of respiratory illness, bronchitis, strep, asthma at this age, ear infection and stomach bugs, accidents and poisonings, unsecured medication. You'd be surprised how often we see that. Or they're getting into cleaning products and things on the bottom shelf. Shock hazards. You want to be sure that you're blocking off those outlets from the time they're able to crawl, and of course drowning. There's a really great mnemonic here. It's 5210 for obesity, and that's 5 fruits or vegetable servings per day. A limit of 2 hours of media or screen time, and at least 1 hour of exercise per day, and 0 grams of added sugar beverages. And that can really help cut obesity to 5210.
And here are our references.
Thanks so much for joining us, and we hope that you learned something that you can apply to your practice.